What is fixation behaviour in children with autism? Fixation behaviours, also known as perseverative or repetitive behaviours, are common in children with autism spectrum disorder, ASD. These behaviours involve intense focus or preoccupation with a specific object, activity, topic, or pattern, to the exclusion of other interests or activities. While fixation behaviours can sometimes be calming or reassuring for the child, they can also interfere with their ability to engage in a wide range of experiences and social interactions. Fixation behaviours can manifest in various ways, and understanding these behaviours is crucial for parents who want to support their child's development and well-being. Types of fixation behaviours. Fixation behaviours in children with autism can be broadly categorised into the following types. 1. Object fixation. The child shows an intense and prolonged focus on a specific object or type of object, such as a toy, a piece of string, a light switch, or a particular type of vehicle like trains or cars. The child may repeatedly manipulate the object, line it up, spin it, or simply stare at it for extended periods. They may become distressed if the object is removed or if they are unable to access it. 2. Topic or interest fixation. The child becomes overly focused on a particular subject or area of interest, such as dinosaurs, weather patterns, maps, or a specific television show or movie. The child may talk about the topic incessantly, seek out books, videos, or other resources related to the topic, and may struggle to engage in conversations or activities that are not related to their interest. 3. Routine or ritual fixation. The child insists on following specific routines or rituals, such as arranging objects in a particular order, eating the same food in a specific way, or following the same route to school every day. The child may become anxious or upset if the routine is disrupted or if they are unable to perform their ritual. They may also resist attempts to introduce new routines or changes. 4. Sensory fixation. The child is intensely focused on certain sensory experiences, such as the feel of a particular texture, the sound of a certain noise, or the sight of flashing lights. The child may repeatedly seek out or avoid specific sensory stimuli, such as touching soft fabrics, watching flickering lights, or listening to the same sound or song over and over again. 5. Repetitive motor behaviours. The child engages in repetitive physical movements, such as hand flapping, rocking, spinning, or finger flicking. These movements may be soothing or stimulating for the child, but they can also interfere with other activities or social interactions. The child may have difficulty stopping these behaviours once they begin. How to help a child overcome fixation behaviours. 1. Understand and acknowledge the fixation. It's crucial to recognise that fixation behaviours often serve a purpose for the child, such as providing comfort, reducing anxiety, or satisfying a strong interest. Start by acknowledging your child's fixation and showing interest in what they are focused on. This helps build trust and makes your child feel understood. 2. Set boundaries and limits. Setting clear, reasonable limits on how much time your child can spend on their fixation can help them learn to balance their interests with other activities. For example, you might allow your child to talk about their favourite topic for a certain amount of time each day, or play with a particular object for a set period before moving on to something else. 3. Introduce new activities. Gradually. Sudden changes can be overwhelming for a child with autism, so introducing new activities or interests gradually can help reduce resistance. Pair a new activity with something your child already enjoys. For example, if your child is fixated on trains, you might introduce a new book or game that includes trains, but also introduces new concepts or stories. 4. Encourage broader interests. Helping your child develop a wider range of interests can reduce the intensity of fixation behaviours and promote more flexible thinking. Offer a variety of activities and experiences, and gently encourage your child to try new things. Celebrate small successes when they engage with something new, even if it's only for a short time. 5. Use visual schedules and timers. Visual schedules and timers can help your child understand when it's time to transition from a fixation to another activity, reducing anxiety and resistance. Create a visual schedule that includes time for your child's fixation as well as other activities. Use a timer to signal when it's time to move on to the next activity, giving your child a sense of control and predictability. 6. Provide sensory alternatives for children with sensory fixations. Providing alternative sensory experiences can help satisfy their sensory needs in a more balanced way. If your child is fixated on a particular texture, offer other textures to explore. If they are focused on a specific sound, introduce other calming or stimulating sounds. 7. Incorporate fixations into learning. Leveraging your child's fixations can be a powerful tool for learning new skills and concepts. If your child is interested in dinosaurs, use that interest to teach counting, reading, or even social skills by incorporating dinosaur-related activities and stories into their learning routine. 8. Model and teach flexibility. Teaching flexibility helps your child develop the ability to adapt to changes and try new things, which is important for their overall development. Model flexible thinking by demonstrating how you adapt to changes or try new activities. Encourage your child to be flexible by offering choices and praising their efforts when they try something new. 9. Work with professionals. If fixation behaviours are significantly impacting your child's daily life, working with professionals such as occupational therapists, behavioural therapists, or psychologists can provide targeted strategies and support. A professional can assess your child's behaviours and develop a personalised intervention plan to help manage and reduce fixations while promoting positive behaviours. 10. Be patient and positive. Change takes time, especially for children with autism who may find it difficult to move away from fixation behaviours. Celebrate small victories and progress, and remain patient and supportive as your child learns to manage their fixations. Fixation behaviours are a common aspect of autism, often serving as a coping mechanism or a way to express intense interests. While these behaviours can sometimes be limiting, with understanding and support, parents can help their child manage fixations in a way that promotes broader development and greater flexibility. By acknowledging your child's fixations, setting gentle boundaries, introducing new activities, and working with professionals if needed, you can help your child build a more balanced and enriching life.